Fleur Anderson.
Thank you, Madam Deputy Speaker. I welcome this important debate, and I thank the members for Sherwood Forest, Rosendale and Darwin, and Godalming and Ash for bringing this debate to the House during Baby Loss Awareness Week, to speak on a grief that touches thousands, often in silence. And I will use this debate to call for a UK-wide perinatal death reduction programme and talk specifically about fetal growth restriction monitoring. And I'm really, really glad that the Secretary of State for Health is here in the chamber today, which shows his commitment, which is well timed today as well to inform the rapid review of maternity and neonatal safety in England. For many, baby loss is invisible and misunderstood. This week breaks that silence. It honours lives cut short, and it stands with families who carry their memory every day. And like other members, I pay tributes to charities like SANS, Tommy's and the Miscarriage Association. Their work must be supported and recognised. But I'm here today to speak with a heavy heart and share the story of Maia Devlin Caulfield, a beautiful baby girl who should be here today. Her parents, Sherena and Jack, came to my advice surgery to tell me about Maia's stillbirth at Kingston Hospital. Though Sherena's pregnancy was low risk, Maia showed signs of growth restriction. Staff reassured her, but failed to act. Maia was born still on the 29th of November 2024. The autopsy showed she was healthy, but died due to a placental condition that halted her growth and breathing. Babies with growth issues like Maia are 8 times more likely to die. And it was Kingston's fetal growth monitoring system that failed her. It diverged from national standards, and despite early warnings, many unsafe practices like this remain. The government's own maternity and neonatal safety investigation into Maia's death made 9 recommendations, yet risks still persist and are not listened to. Sherena and Jack often feel that they are not being listened to, but bereaved parents need to be heard, because by listening to them, we can identify those areas that need to change. And it's about that culture, as well as the regulation and the standards, which all need to work together to see real change. FOI requests by Sherena and Jack have revealed that at least 27 trusts can't properly identify babies with growth issues. And the issue is that many hospitals use a global growth monitoring system that underdetects small babies in high-income countries like the UK because they use data from across the world. UK-developed systems do exist that are based on NHS data and that are safer and used by many units. But Maia was failed by outdated charts, growth charts, still in use by Kingston and St George's and many other hospitals. A key part of the system is these growth charts. Donald Peebles, NHS England's Clinical Director for Maternity, has confirmed that a national safety alert will soon advise trusts to stop using these intergrowth charts. But is there a system to track which hospitals still use them, and how can we update fetal growth monitoring systems urgently? I've also talked to the chief nurse for the South West London ICB, who highlights issues of midwife retention and recruitment, of maternity triage in particular, which needs reform, with a universal standard which will ensure consistency of safety and access, that early warning systems that failed for Maia and are failing others. And thirdly, that just as we have a mental health investment standard, we should consider a similar maternity services standard as well. So the demands for change are that the Saving Babies' Lives Care Bundle, which was published by the NHS England in June 2023, outlines 3 key elements for fetal growth monitoring, but they are not consistently adopted and then monitored to ensure that they're implemented. And there are too few of these deaths in each trust to be able to take those issues and rely on the trust to be able to take the action. It has to be done at a national level. In fact, it has to be done across every nation. It has to be done in Northern Ireland, Scotland and Wales and England. Otherwise, there will be inconsistencies, as there already are, between the different nations. So will the Minister work with counterparts across the UK to ensure that no nation falls behind? Will the Minister meet with Sherena and Jack to discuss how to improve maternity care and look at the findings that they have got? We owe it to Maia. We owe it to every family shattered by preventable baby loss to demand accountability, to enforce standards, and to ensure that no parent is ever told everything is fine when it's not.